Picture something. It's a little after 7 in the morning, and you're standing in your own kitchen in your robe. The coffee maker is doing its slow gurgle in the corner, the window's gone pale with early light, and you reach for a banana from the bowl on the counter, same as you've done maybe 10,000 mornings before this one. You peel it. You eat it standing up 3 or 4 bites, looking out the window or half reading something on your phone. You drop the peel in the trash, rinse your hands, and move on with your day. Nothing in the world could feel more ordinary, but I want to tell you something almost no one will say to you out loud. The way you just ate that banana, the time of day, the speed, what was sitting on the plate next to it, quietly decided how much it actually did for the one number your doctor keeps frowning at when you sit down in his office. And nobody, in a rushed 12-minute appointment, ever stops to do that math with you. My name is Dr. Evan Jace, and this channel exists for one reason: to sit down with you, the way a good doctor would if he actually had the time, and tell you in plain English what the evidence really says about the ordinary things you eat and do every day. No fear, no miracle cures. Just the practical truth I wish I could hand every patient over 60 before they walk out my door. So here's the truth, said plainly. A banana can genuinely help bring down high blood pressure. That part is real, and it's backed by a great deal of serious heart research. But most people quietly cancel out that benefit through a handful of small, completely fixable mistakes. Mistakes nobody warns them about, because explaining them takes more minutes than the system gives us. You've probably been making at least one of them this very morning. One of them is something nearly everyone does at breakfast, and one of them, I'd bet, you have never heard a single soul mention. Before I tell you what they are, do me a small favor. Wherever you're watching from, a kitchen in Ohio, a porch in Georgia, an apartment in Arizona, type your town in the comments and tell me how you eat your banana. Plain? On toast? Sliced into something? I read these, and by the end of today, you're going to see your own answer in a new light. Now let me give you the one idea that makes everything else make sense. If you understand this single thing, the rest falls into place on its own. Your blood pressure is, in large part, a tug-of-war between two minerals. On one side of the rope, you've got sodium, the stuff in salt. When there's too much sodium in your system, your body holds on to water to dilute it. More water in the pipes means more volume, more pressure pushing against the walls of your blood vessels. That's sodium pulling hard on its end of the rope, dragging your numbers up. On the other side of that rope is potassium. And potassium does something quietly beautiful. It helps your kidneys let go of that excess sodium, sending it out of the body. It helps relax and soften the walls of your blood vessels, so they're not so tight and clenched. Potassium is, in a real sense, sodium's natural counterweight, the hand pulling your numbers back down toward calm. Here's the problem with how most of us live. We eat plenty of sodium, it's in the bread, the soup, the deli meat, the frozen dinner, far more than we ever taste. But we eat very little potassium, so the tug-of-war is lopsided. Sodium has 6 strong men on its end of the rope, and potassium has one tired fellow on the other. The pressure climbs. A banana is one of the easiest, most reliable, least expensive ways in the whole world to add a good pull of potassium back onto your side of that rope. That's the whole reason it matters. It's not magic, it's a counterweight. But, and I need you to hear this part as care, not as fear, that counterweight only works when the rest of the picture cooperates. Your kidneys are the referee in this tug-of-war, and they have to be working normally for extra potassium to be safe and helpful. If you have kidney disease, or if you take certain blood pressure medications, the kind that already make your body hold on to potassium, then more potassium is not automatically better, and in some cases it can be genuinely risky. So before you go adding bananas to every meal, I want you to ask your own doctor one simple question, and I'll give you the exact words for it later. This isn't me scaring you off a piece of fruit, it's me making sure the fruit helps you instead of catching you off guard. For most people with healthy kidneys, more potassium-rich food is exactly what the heart specialists recommend. But you deserve to know which group you're in. Alright, keep that tug-of-war picture in your mind, because now we walk through how to actually eat this banana so it pulls its hardest for you, and the small things that quietly make it pull for the other side instead. Let's start with ripeness, because this one surprises people. That banana on your counter changes character as it ages. When it's still firm and a little green at the tips, it's higher in something called resistant starch, gentler on your blood sugar, which matters for a lot of you watching, and it still carries its potassium. As it turns deep yellow and starts freckling with brown spots, those starches turn to sugar. It gets sweeter, easier to digest, but it hits your blood sugar faster. For blood pressure alone, the potassium is there at every stage. But if you're like so many of my patients, juggling blood pressure and blood sugar at the same time, that slightly less ripe banana is quietly the smarter choice. Not green and starchy, just yellow with a hint of firmness still in it. Now timing, and this is where people start to sit up. It isn't that there's one magic hour to eat a banana. It's that when you eat it decides what it's standing next to. And what it stands next to is everything. Let me tell you about a patient of mine. I'll call her Eleanor, 72, sharp as a tack, lives outside Asheville, North Carolina, grows tomatoes she's far too proud of. Eleanor came to me frustrated. She'd heard bananas were good for blood pressure, so every single morning she ate one. Faithfully. And her numbers weren't budging. She felt like she was doing everything right and being lied to. So I asked her the question almost nobody thinks to ask. Eleanor, what else is on the plate? And she told me. The banana. 2 strips of bacon. A couple slices of toast with salted butter. Sometimes a bit of ham. She was eating her good, potassium-rich banana, sitting right beside a pile of sodium, bacon, salted butter, cured ham, and the two were canceling each other out at the breakfast table. Her one tired fellow on the potassium end of the rope, and a whole salty army on the other. The banana never had a chance. That's the mistake nearly everyone makes, and it's the one I most want you to catch. It isn't that the banana stops working. It's that you can plant it right next to its own enemy and never realize you've done it. The saltiest things in the standard American breakfast, the bacon, the sausage, the ham, the salted butter, the cheese, even a lot of breakfast breads and pastries, those are sodium pulling hard, and they will happily undo the very thing you ate the banana to do. So here's what I had Eleanor do, and here's the second half of it. Because it's not just about what to take away, it's about what to pair the banana with. Move it away from the salty plate. Slice it into a bowl of plain oats. Stir it into plain unsalted yogurt. Scatter a few unsalted nuts or some seeds on top. Now look at what you've built. Oats bring their own gentle help for the heart. Yogurt and seeds and nuts bring more potassium and magnesium, minerals that work the same side of the rope as your banana. Instead of one lonely counterweight standing next to the enemy, you've put 4 good hands on the rope, all pulling the same direction. That's not a snack anymore. That's a strategy. Eleanor made that one change. The salty breakfast went to once in a while instead of every day, and the banana moved into a bowl of oats and yogurt. A few months later, her numbers had eased, not dramatically, not a cure, but real and steady, and enough that she and her own doctor were genuinely pleased. One swap. That's all it was. Now let me be very precise here because this is where people go wrong in the other direction. After hearing all this, somebody always thinks, well then, I'll just eat 5 bananas a day and really fix it. Please don't. That's not how this works, and it's the part I most need you to slow down on. The body doesn't reward a sudden binge. It rewards a steady, repeated pattern. 1 banana a day, eaten as part of an overall way of eating that's rich in potassium and lower in sodium, will do far more for you over a year than a wild week of cramming in fruit and then quitting. And remember the referee, your kidneys. Dumping a mountain of potassium into your system all at once is exactly the kind of thing that can cause trouble for the wrong person. Steady beats dramatic. Steady almost always wins. And this brings me to the biggest truth of the whole conversation. The one I'd tattoo on the inside of every patient's eyelids if I could. The banana is a helper. It is not the cure. It is one good player on a team, and the team is your whole way of eating. What the heart specialists actually recommend, and this has been studied for decades, is a pattern, not a single food. You may have heard of the DASH approach. The name stands for Dietary Approaches to Stop Hypertension. And that last word, hypertension, just means high blood pressure. It's not a fad, and it's not a gimmick. It's the simple, well-tested idea of building your plate around vegetables, fruit, beans, whole grains, nuts, and seeds, leaning on low-fat dairy, and quietly pulling back on the salt, the processed meats, and the heavily packaged foods. The banana lives happily inside that pattern. It's potassium you can hold in your hand. But it was never meant to carry the whole load by itself, and it can't. And I want to say this plainly, the way I'd say it to my own father. A banana does not replace your blood pressure medication. If your doctor has you on a pill, that pill is doing a job, and a piece of fruit does not fire it from that job. I'm not anti-medicine, not even a little. I'm pro everything working together. The food supports the medicine supports you. Nobody gets fired, that's the whole idea. So let me hand you something you can actually use. A small routine you can carry to your very next breakfast, tomorrow morning, in that same robe, in that same kitchen. Choose a banana that's ripe, but still a touch firm. Yellow, maybe green at the very tips, not heavily spotted. Eat it away from the salty part of your meal, not riding shotgun next to bacon and salted butter. Pair it with friends from the same team. Plain oats, plain yogurt, a small scatter of unsalted nuts or seeds. Keep the heavy salt off that particular plate. Save the cured, processed, salty foods for less often. And make it a quiet daily habit rather than an occasional heroic act. Choose firm. Eat it apart from the salt. Pair it with its teammates. Keep it steady. That's the whole tool. You'll remember it because it's simple. And then, there's the part that protects you, which matters more than any of the rest. Take 2 honest questions to your own doctor. The first, with my kidneys and the specific medications I'm on, is it safe for me to eat more potassium-rich foods like bananas? The second, are any of my medications the kind that already raise my potassium, so I should be careful? Those are good questions. A good doctor welcomes them. They tell him you're paying attention, that you're a partner in your own care. And I'll tell you something quietly. If a doctor ever brushes those questions off or makes you feel foolish for asking, that reaction is information too. You deserve someone who'll take the 2 minutes. So let's lift this up out of the weeds for a moment, because that's where it really lives. The whole world wants to sell you a miracle food. One thing. One pill, one berry, one powder that fixes everything while you change nothing else. And I understand the appeal. It would be so much easier if it were true. But it isn't, and some part of you already knows that. There is no single banana that saves you. What's real is quieter and, honestly, far more hopeful than a miracle. It's the way you eat on an ordinary Tuesday, repeated across ordinary years. It's the small, steady choices nobody applauds. The firm banana in the oatmeal instead of next to the bacon. The salt eased back a notch. The same calm thing done again and again, until it isn't a decision anymore, just who you are. That's what actually protects your heart across the years ahead. Not drama, not fear. Tending. And here's what I want you to hold on to more than anything. This is yours to do. You don't need permission. You don't need a fortune. You don't need to surrender the pleasure of eating to do it well. You get to stand in your own kitchen and make one small, wise choice, and then make it again tomorrow. That's not a loss. That's you taking quiet, steady control of the years in front of you, of your own independence, of how you feel walking into that next checkup. There is real dignity in that. I see it in my patients every week. So, tomorrow morning, when you reach for that banana, you'll know something you didn't know today. And that small bit of knowing is a kind of power. The kind that doesn't ask you to be afraid, only to pay a little attention. If this helped you see your own breakfast a little differently, subscribe and stay with me. I sit down like this every week to tell you the practical things the exam room never has time for. And do me that favor now. Tell me in the comments where you're watching from, and how you eat your banana. Plain? In oats? Next to the bacon, be honest. I read them, and I just might answer yours. Take good care of yourself. I'll see you next time.